Great. Well, thank you, everybody. Why don't we go ahead and get started? Um, Thank you again for all participating in this session on helping automate the sanctions and exclusion process. We'll go ahead and start the session. We have a number of other folks that continue to join. I'm Tom Leahy. I am the Senior Vice President and founder of SureShield. We provide comprehensive security solutions that help ensure continuous compliance. And I apologize, my colleague, Dr. Sanjay Kumar, fell ill today, and he was planning on participating in the session, but is unable to join. But just to give you a little bit of our backgrounds, I most recently headed up sales and business development for a policy process or policy management and contract management company that was most recently sold to RL Datix, and Dr. Kumar headed up all the product development and product strategy for that company. And then prior to that, we were both founders and co-founders of a company called Quantros. It was at the time the first web-based solution for driving quality metrics management, patient safety, and compliance and accreditation solutions. So our combined experience is almost 80 years in the healthcare industry with particular focus in these areas. So a little bit of the agenda for today. We've already conducted the introduction. As we talked about, or as this session has been labeled, it's really on understanding a little bit of the sanctions and exclusions process and how tools and automation can help make this a much more manageable process. What are some of the, what's the OIG's oversight responsibilities, as many of you are certainly familiar with, some of the current trends that we're seeing in the market today, and obviously with the pandemic it's in place, new challenges that have been placed upon providers to not only help take care of patients, but still deal with a number of the compliance and regulatory requirements that are expected of them. And then we're going to talk a little bit about how leveraging technology like that we provide through SureShield can help make that particular process much more easy, much more manageable, much more comprehensive, and really automated in many ways. And then lastly, we'll provide just a very brief product oversight and demo into a solution offering that we have called Integrity Manager. And then lastly, we should have adequate time to take any questions that you may have. Just as a note, if you go into your toolbar, you will see that there's an area called Q&A on the Zoom meeting. Feel free to type your questions in. We will most likely take those questions at the end of the presentation. And then lastly, as a note for all of the you participating today, the presentation will be shared. You'll have a follow-up email that will come to you. We also intend to share the recording with you. And for those who are interested, we will provide you some information on how you can get your own free trial of the Integrity Manager solution set up for you to do your own test drive of the product. So with that, we'll go ahead and get started in the session. As I mentioned, I think we should probably have adequate time to go through all this and open it up for a number of questions, and also maybe even save you a little time on the hour on your calendar and give that back to you. So obviously as healthcare executives and providers here, you're very aware of who the oversight organizations that come under the Health and Human Services area, that those compliance requirements are under the HHS, and specifically within those two realms are two different offices for very different types of regulatory and compliance oversight. One of those, of course, is the Office of Inspector General, And that particular organization requires, the organizations work with vendors. Anyone who is accepting federal or state money needs to assure that they're working with not only vendors, individuals, providers, employees who have not been excluded or sanctioned from participating in those programs. As many of you know, in order to do this, there's a variety of different databases that need to be checked on a regular basis to make sure that you don't have anyone in your ecosystem who could potentially be be excluded or sanctioned from participating. And if so, and if you are, or you happen to come across an individual that is, it puts your organization at significant risk for some pretty significant fines and penalties. And then, of course, we have the Office for Civil Rights that oversees the HIPAA compliance requirements. It requires that any entity that's working within your ecosystem, again, as a covered entity, that's working with protected health information, has a proper security and risk assessment programs in place to make sure that they are handling that data securely. As many of you know, a number of years back, covered entities would protect themselves by signing business associate agreements with providers that were working with them. And that business associate agreement at the time provided some level of liability protection to a covered entity should a BA have an issue with the breach or a HIPAA violation. Well, that has changed in the last few years. That they're stating now that it's not just having that business agreement in place, but also making sure that you have the proper controls and audit processes in place to demonstrate that you are taking activities to oversee and do oversight of those who are working with you to make sure that they actually are doing that. So in the instance of a breach from a BA, if that covered entity did not have a proper audit trail in place, they could be just as liable for the fines as that business associate. So it's really, as you know, a double whammy. It just puts more pressure on your organization to put the proper processes in place to manage these different requirements. And as we know, the COVID emergency, the COVID-19 emergency has put even more strain on our healthcare system, on providers like yourself and those of you who are working with this. They've done an excellent job of trying to loosen some of the, I would say, privacy requirements just to make it easier to have different types of access to healthcare that were not as easy to have before. However, as the director of that particular program indicated in the most recent semi-annual report, that it is expected while anytime there's a crisis, there's those who act heroically, and then there's also those who may jump in to take advantage of a situation. So it's well expected, and it's already being seen that there will continue to be abuses of the system and fraud related in the system because of the crisis. Folks that are doing things to take advantage of getting access to public funds for the wrong reasons. And as such, the OIG will continue and has continued to ramp up its enforcement over this process. And it's important to note that if you don't have demonstratable systems in place to show that you're on top of this, you're just as open to one, getting defrauded, and two, to being audited by the OIG. And just in 2019 alone, there were over $6 billion in investigative and audit receivables that were collected by the OIG Sanctions and Exclusions Violations Office. And that is expected to continue to grow, knowing that there will be even more expected misuse in the system. They will ramp up the investment, and I would assume, our newly elected president will do the same to make sure that we take care of folks that are taking undue advantage of this terrible situation. So just as some examples of recent exclusions, every month there is a report that is placed on recent exclusions or sanctions. These are just once again pointing out that it's real, and if these things happen, a healthcare organization, practice office can be subjected to some pretty significant fines. And some of the examples of those recently, as you can see here, there was over a $2 million fine for an ambulance service that was improperly billing. We had the Meridian AltaCare Vista group that had a provider that was excluded participating in their, in taking care of patients. And as such, when that was discovered, they were fined for having that provider in their, in their ecosystem. And similarly, another one with a physician. This is just a couple of recent examples of the types of fines and penalties are out there, so they're real. And what makes the process that much more difficult is how you go about overseeing this. As we mentioned, or as indicated, a 200-bed hospital, between the providers that they have in there, the employees that they have in there, the vendors that they have participating, could have in excess of over 1,000 different individuals, companies, or people that they should be checking against. The OIG, while it's not quote unquote mandated, they highly recommend that you are doing checks at least on a monthly basis against those that are in your ecosystem. Now, the difficulty of that, and particularly even today with the straps on resources for anything that I would say is considered more administrative, quote unquote, overhead, knowing that we're having to focus and having more and more of our providers on the front lines taking care of patients. It's just a bit overwhelming and very difficult to do. So many will use things like Excel spreadsheets. It can be an expensive manual process. It's quite time consuming. It requires you to check against a lot of different sources. So those sources include 4 federal databases. And today there's over 38 state exclusion databases as well. If you are a provider that operates in multiple states, you not only have the federal databases and registries that need to be checked, but you also have any of those that are in a state registry. So the ability to, keep up with this is quite difficult. Sometimes folks are working with outside entities or companies that will go and do those checks for you. You provide them, let's say, a list of providers or vendors or employees, and they'll go out and do those checks and provide you that information back in terms of what the status is of those. Now, some of the troubles and difficulties in that from an efficiency process is that they're very static in nature. So, at one time, you could have a provider that was checked and was fine, and literally the next day they could have showed up on those lists. If you had not checked it the next day, then you could be operating with a provider, for months without knowing it. And of course, that puts the entity at great risk. So oftentimes we're finding that the organizations that we've seen, doing this are either doing it periodically, or they're really focusing in on, let's just say, high providers and high folks that they're doing a lot of business with because they consider them potentially more at risk with them. And then they're segmenting the ability to check everything. And, within this process, it oftentimes can be handled by multiple different departments. You may have HR that's checking employees. You may have the medical staff office that's checking the sanctions and exclusions list for their providers. And you may have, let's say, supply chain that's doing work on any vendors that are coming into the ecosystem. So bringing that all together can be quite difficult and costly. And this is just a couple of visuals wanted to provide before we go into how this process can be made a bit easier for you. But as I mentioned before, this is a visual of just alone in the US, the 4 different lists or databases on the federal level that need to be checked. You have the FDA, the LEIE, the SAM, and the OFAC. And as I said before, a lot of people are just going and checking these. They're looking at a provider against those and seeing if they've met or they're sending off any red flags. And then on top of that, you have these 37 other states that have their own exclusion databases as well. So any provider, as we talked about, that is taking money or accepting money from the federal government or a Medicaid program, they have to be monitoring this situation. So briefly, what we provide at SureShield under a product offering called the Integrity Shield is a real-time automated and continuous monitoring process across all these databases. And I'll get into that a little bit further about how that all works. But essentially, it becomes a managed by exception program for you. Our system will automatically check every single one of those databases on a nightly basis, and they will match that up to any of the people, companies, employees that you have in your instant of that. So it will automatically go and take a look at all of your ecosystem when they're in there, and it will be checking that on a daily basis so that if there are any changes to that, it will alert the proper people within that organization. It can be set up very quickly. It saves full deployment in less than 30 days. As you'll see, for those of you who are perhaps interested in trialing this, we really can turn it on in a matter of minutes, and you can begin checking against it instantaneously. It will provide those integrity checks on all of your vendors, your business associates, your employees, your contracted workers. That again is up to you in terms of how you want to use that, but it has the ability to manage that across your whole ecosystem of providers and vendors. And additionally, if there is interest, we also provide the ability for an organization to perform, what we would call HIPAA risk assessments on their vendors, those vendors that are handling PHI. It's another utility that's part of the process that can be done to help you audit those vendors and get the proper audit and paper trail in place that shows that you were trying to demonstrate oversight of those to make sure they were carrying out the requirements of those BAs. And of course, this comes with a very comprehensive set of reports and comparative analytics that can allow you to profile that information in any way that you like. So, leveraging the technology and leveraging technology like this, it allows for improved and automated oversight of all your ecosystem. And that is something that is really quite difficult to do today. Once you've turned it on, it's actually working for you almost like another colleague within your organization. Obviously, can help avoid the types of fines that we had just looked at previously. And even in the cases of self-reporting, so if an organization were to have identified that they unbeknownstly had been working with someone, by reporting that, at least doing that, you don't get slapped quite as hard, meaning that you've self-reported that information rather than it being audited and found out without your knowledge. But at the same time, it still does not abscond you or absolve you of any of the fines. And then it also, within here allows you to kind of break down the silos. It has workflow built into it that allows you to push out different areas of work to different groups within your facility if you so choose. So if you wanted to have, let's say, the supply chain doing the vendor checks and the physician offices doing the physician provider checks and someone else doing the overall employee checks, you have the ability to set it up in that fashion while still having your full comprehensive oversight in view of that. And again, this is a bit of a busy graphic, but just to give from a kind of a technological perspective and how this is working, what we've done is develop technology that allows us to go, what we would say, scrape all of those different databases. The federal ones we mentioned, the state exclusion, and we're actually expanding that into practitioner licenses and credentials as well as part of this. We scrape those databases on a nightly basis. We consolidate that information, and then, as we said, we match it and query it against each one of our customers' specific instances of that, and then utilize that to provide the exception-based reporting and information in a dashboard sense. So once it's on, it's working for you 24/7. There's no need, again, to ever have to send anything out to be checked. It will be doing that for you ongoing. So I'm going to pause there, and I'm just going to spend a little time to just give you a visual overview of how this works from a product perspective, how the product works. So let me just move over to this. And what you should be seeing here is, in this case, it's an organization called Bloomfield Clinics. I'm now in the Integrity Manager solution provided by SureShield, and I'm under the auspices of an organization called the Bloomfield Clinics. And what we provide here are color tiles that are kind of help you almost in the red light, green light, yellow light view process to let you know, obviously where you might need to direct your attention. So within this particular database, as you can see, I have 208 records. So we're relatively, relatively small clinic in this sense. We have providers that have over 12,000, records in here, because between their vendors, their employees, sometimes those numbers are even higher. That can be quite significant. So what it's telling me I have these records. It's also telling me how those records are broken down. There's obviously 19 employees, there's 166 entities, there's 23 individuals. If I were to go into this, it would give me a breakdown of all of those different entities that are in this particular database. And it will give me some visuals on what the status is with those. So keep in mind, one of the other things, and the nice things here, because if you are looking to, let's say, bring in a new provider or a new contractor, most likely you should, and hopefully are doing these kind of these checks as part of the contracting process. So we give you the option when you're even setting this up to screen, to do pre-screens on people that might be coming in. And then once they're in as a contracted entity, the system will be screening them at all times. So you can see here, there's things like, you can even put risk identifiers on them in terms of the criticality of the business that they're providing. But you'll see in here, I've got the list of all of these different entities that are in here. We have a really nice simple filtering criteria as well. So if I only wanted to, let's just say, look at those that were employees, I would just click and it would filter down to those employees themselves. More importantly, if I wanted to, let's just say, see those that popped up, let's say on that sanctioned list, I could filter this and it's bringing me and showing me these entities that fell onto this list. At any given point, I can go in and take a look at those entities. It will provide me a full audit log. So again, something very critical. If you're doing follow-ups and on these, and it will actually have all of the previous and all the audit paths on that particular vendor. You'll notice that it had this kind of frowny face basically on it. If I were to click into that again, it's not only going to help me identify the different, what those sanctions were for, but who were the providers that were part of that. What were the ones that popped up? What were the provider lists that they showed up on? So in this case, this particular entity showed up on the LEIE and the SAM. Again, depending upon, because all these databases are a little bit different in the nature of the information they provide. The more detailed that information is, you can actually drill into that to find out what were the reasons, for instance, for that particular exclusion. So this individual was in here on the LEIE because of fraud, kickback, and other prohibited activities. We allow you within the system, sometimes you might get a notification on a provider, and while you're checking against this, it's not uncommon every once in a while there can be some mismatches. So it allows you to do things like initiate requests for data or initiate a request for verification that you could then use to send out to that provider and saying, hey, this came up and I want you to validate and show me documentation that this is or is not true. So within here, it provides all of that different types of follow-up activities. It can also allow you to ask for initial information on that provider, as you can see when I scroll over this particular area. And then even more importantly, because we're doing this in a longitudinal nature, it will even pick up past infractions. So you could have a provider that you're working with today that is fine, but in the past, they actually were on that list. So it would allow you to actually, if that were the case, to go in and click on that past and see what the rationale or the reason was as to why they showed up on there. And always have that level of audit log and history. Again, within here, you also have the ability to do a variety of different reports on this. So I'm going into this particular area, and without going through all the different reports, because the data can be manipulated and used in a variety of different ways. In this case, I have my exclusions and sanction status reports, my summary reports. If I were to go into any one of these reports, I actually have the ability to run that. And then if I want, I can actually schedule these types of reports to be sent out to different individuals. So if I wanted this to go to, let's say, 4 or 5 different people within my own organization who are users, I can schedule the report and indicate who that individual is, what that report's name is, and when I want them to get that. And as I had showed previously, you can also, of course, segment based upon the different provider types. So again, if somebody was just handling the employees, they would be going in and seeing their own employee view of that information. So as I had gone through again here, you can see on my filtering criteria, it's easy for me to break down and look at those different entities. If you are an organization that has multiple, let's just say, entities, multiple hospitals, or multiple providers within that ecosystem, your hospitals, your physician practice, your home health agency, the hierarchy that can be built up in here for you to slice and dice that data is built into this solution. So that is a quick overview, just to let you know. As well, it's very easy for me if I wanted to go ahead and check on my own. So this is why we say we can easily start you on a free trial, because you can just go in. While we have automation tools that can help bring your whole ecosystem in very quickly, you also have the ability to just go ahead and check that on an as needed basis as well. So you can see in this case, I'm doing this in a manual process. I can indicate, for instance, what is it that I'm checking against? Is it a contract worker? Is it an employee? Is it a vendor? Is it a vendor that's an entity, a vendor that's an individual, a BA? And again, I can even do this prospectively or as well. And all it really requires me to do, and we probably won't come up with anything, but I will just try and see if anything comes up. We probably aren't going to find anything. It's just asking me for more information. The more information I have, the easier it is to match against those. But what it basically does is it's going to go instantaneously and check against that and say, nope, nothing came up on this particular provider. Everything is good. If it wasn't the case, then you would have that data that would show what matched, what was the reason, and why did they end up in that. And then again, as we talked about, this is doing this on a continuous 24/7 basis. So anytime there is a modification or a change in the status of any of those that are in there, it's going to notify you by email. It's going to show up in a task area for you so that you can go in, take a look at that, and do that in a very expeditious and complete method. So that's the brief overview of the Integrity Shield solution. What are some of the key business benefits of using this? Obviously, it's ease of use. It's a simple to use interface. You've got a ton of different reports you can get out of it. It's comprehensive in nature. Like I mentioned, it really acts as an assistant to you, to some degree, a robotic assistant that can do the work that's virtually impossible for you, or very expensive and very static if you're doing it with other types of methodologies. It's simple to set up, and it really helps meet the obligations of following those requirements from the OIG and the OCR. And again, to summarize in the presentation, as we talked about earlier, even amidst this crisis, the OCR and OIG are going to continue to ramp up enforcement because of certainly any monies that have been paid out. They want to make sure that those that have been paid by the public are done in a truthful and lawful way. And if they're not, they're going to be looking to enforce recovery of that. Obviously, the COVID today is just one example of new bad players that could come in on top of all the wonderful and great players we have that are really trying to help manage this situation. And, lastly, how integrated tools can actually make this process a bit more simple, a lot more efficient, and a lot more cost effective. So with that, hopefully I've been able to buy you back some time in your very busy days. If you would like, a further more in-depth demo or information, please come and visit us at info@sureshield.com, sure-shield.com, or visit our website. You'll also see other solutions that we provide in a comprehensive nature to help, healthcare organizations with their security, compliance, and oversight processes. As I mentioned as well, if you would like your own, I would say, instance of the Integrity Shield solution, you'll be receiving a email update after this. That, as I said, will include the presentation, should include access to the recording. And then it will just ask you to verify that you would like to be set up, and we will go ahead and get you set up for that. So with that, we'll go ahead and open the Q&A processes. If you were to kind of scroll down on your toolbar, you should see a Q&A section show up. I appreciate it. It looks like all of those who attended are still attending. But please go into the Q&A and type in any questions you may have, and hopefully we can answer those for you. And then after that, we will go ahead and conclude the session. Okay, so I actually have a question that's related to more to pricing. So how is the product priced is the question. Ours is a annual subscription, or it can be an annual or a monthly subscription based upon the number of records that are being checked. And the bigger the institution, the price per check goes down. We would tell you that it's roughly about $4 to $5 roughly on an annual basis per entity checked. And much more cost effective because one, it's doing that for you again continuously and consistently, and there's no cost per check. So essentially it's checking every single day. Anytime you want to come in and do your own checks, you can do that, and there's no additional fees for that as well. Great. I have another question. How does this get deployed? So as I mentioned, this is a web-based product. You would have an instance activated for you. It's a secure site that you would go into, and obviously it's protected in terms of any type of users that are in there. Has roles-based usage. You would get access. You would set up and create your own unique password and username and password into the system, and then it's web enabled and cloud enabled for you. It also, for our larger entities that we're working with, they like to set up some, I would call them APIs, or we previously called them interface processes that will allow us to get access, say, to systems you're using to manage employees or vendors or physicians, so that you can have automated updates to those when we bring them into the system. And certainly if there's any additions or deletions to those, they would get pulled out of the Integrity Shield product. That does not mean the data gets pulled out, but those vendors, if they were pulled out, would no longer be at that point checked against. We also provide some really simple, I would call semi-automated tools that allow you to update CSV files, Excel files to rapidly bring and segment in those that you want to check against. Another question, you mentioned that you also have the ability to do risk checks on vendors. So yes, this is a different, it's an extended offering of the solution. But if you have, for instance, if you're on the supply chain side, you may have some regular audit, HIPAA related audit questions that you want your vendors to provide to you. And also documentation, for instance, that they've done their own risk assessments on their own environment to assure that any PHI data that they have is protected. So it's another part of the ecosystem that allows you to push out your own specific audits to those, allows you to manage their responses as that data is coming in, and then allow you to actually manage the profiles of risks on those groups. And again, very difficult to do if you don't have, technology solutions that can help you with that process. Okay, I am not seeing any more questions. I will hold for just another instance to see if anyone else wants to add to this. And If not, I do not see any other questions coming across. Again, we want to thank you all for your time today. We wish you all the best in the work that you're doing to take care of folks out there in our healthcare environment, and hope on the follow-up that if you're interested in getting your own free trial, we'll get you set up with that. So again, thank you everybody for participating, and have a great day and a great rest of your week. Thank you.